The world has suffered through countless epidemics and pandemics which have had long-lasting effects on the world as we know it today. We can really learn a lot looking back to the past, from malaria, the Romans with the Antonine Plague, the Black Death, the Spanish flu, into the even more recent COVID-19. But to really understand its impact, we need to get our terminology right, and then we can look back at history. So what are the differences between an epidemic and a pandemic? An epidemic is a disease that has more cases than usual in a local region or community. A pandemic is when that increase in cases of a disease spreads worldwide. After the devastation of World War I, the 1918 Spanish flu was the next major world event. It was the worst pandemic since the Black Death that killed a third of Europe's population. It was initially thought that the disease was caused by the alignment of Saturn and Jupiter, and the planets influenced the disease on Earth somehow. That's how it got its name, from the Italian word l'influenza. The earliest documented case was in March 1918 in Kansas, with further cases recorded in France, Germany, and the United Kingdom in April. 2 years later, nearly a third of the global population, or an estimated 500 million people, had been infected in 4 successive waves. Estimates of deaths range from 17.4 million to 100 million, with an accepted general range of 25 to 50 million, making it one of the deadliest pandemics in human history. With Spain remaining a neutral country during the war, Spain was one of the only countries that reported on the disease, which led people to think that the disease originated from there, which is not at all true. More locally in Aotearoa, the war had killed over 16,500 New Zealanders in 4 years. Yet in just 8 weeks, the flu wiped out over 8,600 New Zealanders. The mortality rate of Māori was more than 8 times higher than that of New Zealand Europeans. Māori suffered heavily with an estimated 2,500 deaths. Little was known about viruses at the time. Aspirin was given in hospitals to bring down temperatures, as this offered some relief of symptoms. Samoa was the worst hit country in the world, with over 8,500 deaths, or 22% of the population. The disease was spread to Samoa by the SS Talune ship, which arrived in Apia from Auckland on November 7, 1918, with sick crew on board who disembarked and spread the disease in the nation. The New Zealand administrator of Samoa, Colonel Robert Logan, did not put the ship under quarantine when it arrived in Apia, and he did not accept the offer of assistance from the governor of nearby American Samoa that may have reduced the death toll. In 2002, New Zealand Prime Minister Helen Clark made an official apology to the Samoan people for the actions of the New Zealand authorities. A 1947 United Nations report called Samoa's outbreak one of the most disastrous epidemics recorded anywhere in the world during the present century, so far as the proportion of deaths to the population is concerned. In Samoa, as an oral-based culture, some families also lost a lot of their oral histories and the indigenous knowledge that had been held by older family members who died during the pandemic. From knowledge of the environment and medicinal, healing plants to family land boundaries, genealogies, and family connections. In December 2019, there were a cluster of pneumonia cases in Wuhan. Investigations found that some of the cases had been working at or visited a seafood and live animal market. The disease was discovered to be a new coronavirus on the 30th of January 2020. The WHO then labelled this as a public health emergency of international concern. Millions of people have died worldwide due to COVID-19. USA, India, and Brazil are the 3 nations with the highest fatality rate. The first case of COVID-19 was reported in Aotearoa on February 28, 2020. What followed was heavy border restrictions, several national and regional lockdowns, led by a 4-level alert system introduced by the government on March 21, 2020. Aotearoa's first death was reported on March 29, 2020.
Sadly, New Zealand has had its first death linked to COVID-19 on the West Coast early this morning. The death was in a woman in her 70s who had
COVID-19 surpassed the 1918 flu as the deadliest disease in America, with the country's indigenous peoples disproportionately affected. Data provided to The Guardian shows COVID-19 was killing Native Americans and Alaskan Native peoples at twice the rate of white Americans, while the death toll is expected to be higher, with multiple states providing patchy or no data at all on the Native Americans lost to the virus. In New Zealand, cases among Māori have increased in recent weeks. Minister Peeni Henare said the following at a press briefing on October 19th.
In the last 2 weeks, Māori have made up 45.7% of total cases versus 28% throughout the entire outbreak.
Throughout history, there have been many pandemics that have devastated the world, causing countless deaths. And there will be more pandemics in the future. Today we have a lot more tools such as vaccines and other advances in healthcare to help prevent contraction and death. As a result of pandemics, we have made massive strides forward in the likes of science, healthcare, hygiene, sanitation, and nutrition that have made society stronger than ever before. Our ability to learn from history has enabled us to fight back better and act quicker to safeguard future generations from the losses of the past.
Thanks for checking out our YouTube channel. To stay up to date with all the latest news from the New Zealand Herald, click the subscribe button below or check out one of the videos here, and head over to nzherald.co.nz for more details on these stories and more.